I think one of the most gratifying parts of being a transplant surgeon compared to any other kind of surgeon is that you have the gratification of seeing your work come to fruition. When most people go to a doctor's office, they're usually in crisis. They're at a point in their life that they want to put past them. In a hair transplant office, it's the opposite. Patients come to you and they're looking forward to something. And when they come in and we take care of them and we change their looks, they'll come back to my office sometimes every year just to say hello, just to show us how they're looking. And I have the satisfaction of taking an after photograph and comparing it to the before photograph. And there's nothing like taking out the before photograph, showing it to a patient you did a surgery on, because they almost always forget what they used to look like, and seeing the look on their face. The smile comes across their face. They can look back at that time that they consider to be in crisis and say, now I'm well, now I'm happy, now I'm healthy. And as a hair transplant patient myself, until I saw my own before photographs, I'd completely forgotten what I looked like. I said, wow, did I really look like that? So I even keep a before photograph of myself, and I took an after photograph of myself, just to remind myself that I did it too, and that it made me happy, and it was satisfying. And I suppose that's really it. There's very few areas in medicine where you get to see the patient again and get a thank you and see your work visibly, because you're not going from negative health back to normal health. You're going from normal health to a higher state, and that's very satisfying as a doctor.